Hi, everybody. I'm Dr. Carol Fox, and I'm here today with Dr. Heather Walker. Dr. Walker is a member of our emergency medicine department and the president of our medical staff, and also with Mike Sekhon. Mike is the director of pharmacy for Excella Health. And we're here today to talk to you about the coronavirus vaccine. We know that you have a lot of questions about it, and we're here to do the best we can to answer them for you. So let's get right to it.
So, Mike, we're going to start right now with our first question on the vaccines. Can you tell me how I would sign up for a vaccine if I'm an employee or a member of medical staff?
So managers are going to be responsible for the scheduling of all their staff. There's a couple reasons for this. First and foremost, the adverse events that could occur from getting a vaccine closely mimic the COVID-19 vaccine, not vaccine, but the disease itself. So we want to space people out as to not miss work days. So based on that initial survey, we want to go ahead and take all of our employees that agreed to get the vaccine, schedule them, and then also review the rest of the staff and make sure that they have an opportunity to either change their mind and get on that list up front.
How will I know when a vaccination time is available to me?
Yeah, so the manager is going to go ahead and send all of that data over to the call center. The call center is going to come back and give individual slots of time. So your manager is then going to get in touch with you and let you know when you're scheduled to get your actual vaccine.
If I initially thought I wanted a vaccine, but now I don't, or vice versa, am I able to change my mind?
Yep, absolutely can change your mind either way. So if you said yes in the beginning and now you've chosen not to get the vaccine, just simply let your manager know. And on the other side of the coin, let your manager know. Now, with the knowledge that if you do change your mind from a no to a yes, you may be a little bit down the line. So you'll be put at the end of the line of those people that are going to get the vaccine.
Is the vaccine a condition of employment?
It is not. So with an emergency use authorization and the unknowns with the vaccine at this point in time, we highly encourage staff to get the vaccine. However, it is not a condition of employment right now.
When the vaccine's offered, where will I go to get that
immunization? So it is going to be offered through all three hospitals, and the sites are the walkway in the parking garage for the Westmoreland site, in front of the former Little Shop at Latrobe, and in the main lobby at Frick.
So, Mike, I have another question about vaccine safety. Can you tell me how safe is the vaccine and what's the process that went through in order to make that assurance to the people receiving it?
Sure. So the FDA has approved the vaccine, the Pfizer vaccine, under an emergency use authorization. So that is, in short, an abbreviated study and approval process for a drug. Now, there are a couple things that are important to note under an emergency use authorization. That doesn't mean that the drug has not been studied at all. There's actually been several studies and there's ongoing studies around this drug. What is missing on an emergency use authorization compared to a normal drug approval are some of the details and ancillary studies that go along with it. So, for example, they don't currently know, and there's no details out there surrounding very specific special populations. So think people that are currently immunocompromised and have HIV, or use in pregnancy. So some of those things are going to be extrapolated from other studies or what they know so far with the limited data. From a safety perspective and effectiveness perspective that would be used to get a drug FDA approval, all of those things are virtually identical to a normal drug approval.
Heather, can you speak to me a little about the vaccine, such as who will be receiving the vaccine and any contraindications or allergic issues I need to be concerned about?
Excella Health is very pleased to be able to offer the vaccine for COVID-19 to all healthcare-related professionals and all members of their medical staff. We have been fortunate to receive what we feel is a large and generous allocation of these vaccines. All persons who are eligible are encouraged to receive this vaccine, but will not be required. There are some medical conditions, because this has been an emergency use authorization, that have not been studied, and therefore you should contact your primary care provider or other specialists before receiving this vaccine. These include immunocompromising conditions such as HIV or the use of chemotherapy or immunocompromising drugs. You may still be eligible for this vaccine. We just recommend that you consult a provider first. Additionally, pregnancy is not an exclusion criteria, but we would suggest that you contact your obstetrician in regards to receiving this vaccine.
Does that include breastfeeding?
At this time, it also includes breastfeeding, simply because this vaccine has not had the opportunity to be formally studied in pregnancy or breastfeeding. Initial data from the American College of Obstetrics and Gynecology indicates that they feel it should be safe, but again, we would encourage you to have a conversation with your provider.
We've had a percent of our employees themselves or employees who are exposed to others who have had COVID. Should they receive the vaccine, and when should they receive the vaccine?
The initial data from the FDA is encouraging all persons who have had COVID or who have been exposed to COVID to continue to receive this vaccine. If you are currently recovering from COVID, we ask that you wait until you have recovered from your symptoms and your initial quarantine period is over before receiving the vaccine. If you are currently quarantining due to a positive household member or another close contact, we ask that you schedule your vaccine date after your quarantine period has ended.
So a question that we've heard from our employees is, can you contract COVID-19 from this vaccine?
You cannot contract COVID-19 from this or any of the vaccines currently in development. None of the vaccines currently in development, including the Pfizer vaccine that we are scheduled to receive this week, contain any live or any attenuated virus. They contain messenger RNA, which is a protein of the virus. This allows your immune system to mount an immune response without ever needing to be exposed to a live or attenuated virus.
Another question several employees have asked is around allergies. So if I'm allergic to eggs, can I get this vaccine, unlike the flu shot?
This is very different than the flu shot. This is not a vaccine that was developed using egg or egg protein. So an egg allergy is not a contraindication to this vaccine.
What if I do have other allergies? How do I know if I'm allergic to this vaccine and whether or not I should get it?
The FDA called out that persons with allergies should look at the ingredient and component list for this vaccine. Most people with allergies will still be able to receive this vaccine without any issues. We've had multiple questions regarding food allergies, environmental allergies. There does not seem to be any indication that those allergies should create any cross-reactivity or any additional problems with this vaccine.
One last question is, if I've had a vaccine, let's say I went and got my shingles shot or I went and got another vaccine last week, can I get this vaccine today?
In general, overall vaccination guidelines recommend that you wait approximately 14 days or more between receiving vaccines of any type. So if you had a shingles vaccine recently, please plan to schedule your COVID-19 vaccine 14 days or longer between.
So what if I take other injectable medications? Can I take that? You talked about the space between vaccines, but can I take it?
Yeah, currently, although the recommendation exists for spacing of vaccines, there is no information that this vaccine or any other vaccine for that matter needs to be spaced from other injectable medications.
Back to the allergy question. Lots of people, again, are worried about what if I have an allergic reaction? What will happen? How will I be taken care of? What to expect?
We're very fortunate that although it was originally reported, particularly in Great Britain, that there may have been several severe allergic reactions, it turned out to be an extremely small number out of the total population that was vaccinated in their initial rounds. We are pleased to report that our initial vaccines, as they're taking place on hospital campuses, both the personnel giving the vaccines will be trained and prepared for any immediate allergic reaction. Our emergency departments will also be prepared to receive any patient who seems to be having an allergic reaction or any other problems surrounding giving or receiving the vaccine. It's for these reasons, although the incidence is very, very small for any type of allergic reaction, If you're not working, we would simply ask that you wait somewhere on or near the hospital campus for 15 minutes after receiving your vaccine prior to going home.
So let's fast forward to the day I'm getting my shot. What should I expect on that day, and then what are the potential side effects afterwards?
So on the day of your vaccine, it would not be uncommon for you to experience a sore arm or a red arm. That's something that we see typically with just about any vaccine that you could get. With the COVID-19 vaccine, a certain percentage of individuals who receive the vaccine will experience a fever or body aches or myalgias. Of course, those types of symptoms mimic those of the flu or COVID-19. If you have those types of symptoms, we would ask that you remain home from work. If those symptoms resolve within 24 to 48 hours, you may return to work. However, if they are persistent, we would want you to contact employee health to receive additional instruction as to what to do next.
So, red arm, can I come to work if my arm's red, and how do I treat that?
Absolutely, you can come to work if your arm is red. You can use warm compresses or cool compresses, whichever feels more comfortable to you, and you can use Tylenol or an over-the-counter anti-inflammatory medication for the discomfort.
My understanding is I'm going to have to get a second shot. So, or I get scheduled for that whenever I arrive?
Absolutely. You will be scheduled for your second vaccine 21 days after your first one. And it's important for you to know that it may be slightly more likely that you would get a reaction after the second dose of the vaccine. If you had a reaction the first time, as long as it was mild, it is not a problem to get the second dose. Even if you had a more significant reaction, we would ask that you speak with your physician to determine what your next steps ought to be. But for most individuals, you can receive both doses of the vaccine.
If my second dose gets delayed for I'm either sick or I'm unavailable or something happens to delay it, what do I do? Do I start over again, or do I just pick up from where I was?
You do not have to start over if you get off cycle. You can get the vaccine as soon as you remember to do it.
So we're all tired of wearing masks, gowns, gloves, goggles, and all of this PPE. But so after I get my vaccine, am I done? Can I go back to normal, or do I just continue social distancing and wearing a mask?
Gosh, I really wish that we could stop wearing masks and stop social distancing, but that's really not going to be the case, at least not in the short term. We expect that people will develop protective immunity within 2 to 3 weeks of receiving the vaccine. But until a large number of individuals are immunized and have developed immunity, we all have to continue to wear masks and to socially distance.
So just to clarify, when am I protected against COVID?
You're protected against COVID 14 to 21 days after your second dose of the vaccine.
So one last question for today. When does the vaccine cause genetic or permanent genetic changes?
That's a really good question, Denise, and a lot of people are asking about it. And because it's so important, I'd like to read a statement from the American College of Obstetrics and Gynecologists. The mRNA vaccines are not live virus vaccines, nor do they use an adjuvant to enhance vaccine efficacy. These vaccines do not enter the nucleus and do not alter human DNA in vaccine recipients. As a result, mRNA vaccines cannot cause any genetic changes.
I want to thank the panel again for their time today, and I want to turn it back to the panel for one final thought.
I plan to get the COVID-19 vaccine.
I plan to get the COVID-19 vaccine.
I plan to get the COVID-19 vaccine, and we hope that you do too.